Dr. Joe, we've got a question from Mary. She wants to know, why did you want to become a chiropractor? And how did you get started in this profession, in your profession? And I think this would be a good question for both of you to answer. So, Dr. Joe, why don't you take it first, and then Dr. Jeff, you can answer after.
Okay. Sure. I share this story all the time, and it's the reason why I jump out of bed and hit the floor as fast as I do every morning, because I'm so passionate about what I do. I'll paint a picture. I was the third and last born in the family. And I was about a year old, and every time I stood up, I'd fall to the left. And then my parents decided to take me back to the doctor, not for an exchange or a refund, but for a checkup to see what was going on. And the doctor said, well, back then with the technology, there wasn't that much technology for diagnostics, so they took an X-ray of my pelvis. And there's a test where you grab the baby's ankles and you push them back. I believe it's called Ortolani's test. And it checks to see if the hip sockets are in the ball and socket. So 95% of all hip dislocations are anterior or in front of the pelvis. So as you do Ortolani's test, you would notice that you would see the ball and socket stick through the skin a little bit. If you knew that it wasn't inside the joint, it would come out through the skin. Well, I was 5% of the population of hip dislocations. Mine was posterior or behind the pelvis. So when they checked it, they didn't see that bone rise. But on X-ray, they realized that I had a dislocated hip. Now, I was a little over a year old, maybe a year and a half, and because of that, the fact I had no weight-bearing stress, my femur bone in my left leg did not grow as long as the right one. So still to this day, my left leg is 1.25 inches short. I keep my tailor really busy taking in all my pain. But I'll fast forward. What ended up happening was I wore the Forrest Gump style braces, the corrective shoes with the steel inserts, and I slept with my feet like this at night. And I was on a number of medications, from steroid to pain relaxers to muscle relievers to anti-inflammatories. And because of that, I was about 30% overweight as a child. So the picture I'm painting is a kid with steel braces, borderline obese, is not the #1 draft pick for the kickball team at recess. So we know how fourth graders can be, right? So it was around 8th grade, and somebody recommended that my parents take me to a chiropractor. They said a bone and muscle doctor, and I went in, and he talked about positive mental attitude and talked about my pelvis and exercise and diet and rest and everything that I talk about in my book. And within a year, I was off out of the braces at that time. I was off all my medications, and I was playing junior varsity football in high school. So a complete turnaround in my life in about 2 years. And I knew that this was something I wanted to do, and I specifically wanted to help adolescents and children, and I specifically wanted to work with people with traumatic birth syndromes and dislocated hips like myself, as well as some athletic injuries.
Oh, very cool story, very inspiring.
Thank you.
Dr. Jeff, how about yourself?
Actually, I wanted to be a brain surgeon, and at the time, my grandmother was dying of cancer. So when I went in to speak to the doctors on her behalf, she had 3 of them, each one gave me a different answer. And none of them would say they didn't know what the problem was. None of them would say that the other one was wrong, but they couldn't all be right. So the whole philosophy behind the medical community did not resonate with me. I like to solve the problem, not treat the symptom. And I didn't like, because she was treated very coldly because they were dealing with her condition, not her. I didn't like the whole way things were done. So a friend of mine happened to be in chiropractic college at the time, said, why don't you come down and take a look? It's the same as medical school because we get the same exact training. We get more in diagnostics. They get more in pharmacology because they treat drugs. As a profession, they choose to use drugs for treatment. We as a profession choose not to. So I went down there. I saw my friend, saw the school, saw what one chiropractic adjustment can do, and I said, why would I do anything else? I can head it off at the school. And I said, I'm going to be a chiropractor.
That's awesome. So that's cool that you switch gears like that from going to be a brain surgeon to being a chiropractor.
Yeah, I thought it was, I thought, wow, brain surgeon, I'm going to really do a lot of good and help a lot of people. And then the more I talked to some of the doctors, I just man, I just don't, I don't feel it. I don't feel it. I don't want to just make a lot of money. I want to help people. I don't want to just, oh, well, he's a brain surgeon, that guy. So what? Everything is either you got to mask the symptom with a drug or cut the hand off. You don't feel the pain anymore. Well, that's not what I want to do.